When it comes to, aesthetics, one of the things that I find that really bothers men is loss of hair, or, as we call male pattern hair loss, male pattern alopecia, or androgenetic alopecia. Um, it's genetic, runs in families, hormonally driven. So high testosterone really leads to that. Um, and guys, you don't have to suffer with that. There are treatments out there that can really help you. Number one thing is to consider a testosterone inhibitor. There's two in the market, finasteride and dutasteride. They can be used as pills, which are more effective, or topicals for men that are scared of side effects of the pills. The pills, for the most part, are really, really safe, but very, very rarely can have some sexual side effects, which are typically reversible. So on top of, those testosterone inhibitors, finasteride and dutasteride, there's also minoxidil. So minoxidil can also be given as an oral or a topical. Rogaine is the kind of brand name out there. The oral version is, of course, more efficacious and really minimal side effects. The only potential side effect that the small doses that we use for hair loss would be hair growth on the face, which, wouldn't bother most men. Finasteride and dutasteride, the testosterone inhibitors, they don't necessarily make you regrow hair, but they slow down the progression of the condition, which the condition is chronic. So if you don't do anything about it, it just gets worse and worse. So slowing down progression is winning. Minoxidil is actually a hair grower. It's a vasodilator that improves blood flow to the hair follicles, and with that, you have potentially more hair growth. After you use those two, agents, if you still want a more improvement, there is a procedure that can be used called PRP, or platelet-rich plasma injections. So you take blood from people, extract a portion has growth factors, and inject on the scalp. You do a series of treatments, initially 1 month apart, and then eventually go into maintenance, which is typically 6 to 12 months. This particular treatment can lead to decreased loss, so it slows down the progression. The hair follicles get thicker, so that gives you more hair density. And I would say in 60% of men, hair regrowth in different, amounts. Some people regrow more, others less. The combination of finasteride, minoxidil, and PRP is the golden combination. If you want best results, that's what you go for. So if you're a guy suffering for hair loss and you want some help, come see us at Skintap. We can give you prescriptions that you need and refer you to a specialized center with dermatologists that can provide you with PRP if you wish. Come see us.